don't rely on luck and pray. The patients won't say anything, but when you genuinely want to do a good treatment and want to help them and provide the right care for them, they can sense it.
CPD Junkie Dental Podcast is about connecting with passionate Australian dentists who are improving themselves and have attended various CPD courses. My aim is to find out for you the best CPD courses around and what they did to help get them to where they are today. So you can consider doing it and becoming the best dentist you can be quicker.
You're learning about cosmetics, you're learning about the photography to reassess your work. I guess this kind of comes back to where you were when you were assisting and you were learning from, trying to reach that perfection level. How are you going about learning cosmetic when you've got the ortho, you've got the implants all happening at the same time?
To be honest, with my mannequin, Maxim Belograd, he's like, I've never met him. I've talked to him on Instagram a couple of times. I've told them that I'll come visit you soon. I wanted to go but then the Ukraine thing started, the war thing.
Yes.
So I couldn't. Maxim Belograd has so many amazing videos. He shared cases as well on optical illusion, on his concepts of preps. And every time, and even I do it now, and some people think that this guy's, he's free time, or I don't know. Yeah, I don't have free time, but I feel like it's important. The mannequin I have, every time if I'm doing a veneer case on Monday, the same preps or the same composite, I'm going to do it on Sunday. I'm going to spend 3 hours. I'm going to do it in the mannequin. So same thing as I said, you look at the photos and you can see your mistakes, so you can plan your cases. Same thing, you sit down and take the burr and prep the teeth. I feel like the best way to learn, and we say this case is no prep and this case is prep, and this case we do really minimal. This case we have to do a crown, or this case we do a 4/4 crown. The only way to learn is you do it yourself. Because majority of the time you might notice, if you actually say, okay, let's forget about what everyone say, let me just do it by myself, you might create that one technique that it was missing with all the other clinicians as well. Because now it's your way of developing something. Like we all know how to do crown preps. There's so many videos available. Like if someone says that all ceramic crown is done differently in Canada or in Pakistan or in Australia, it doesn't make sense, right? It's the same way done everywhere in the world. But if you actually do it, you might say that if I do this way, I never get an undercut. So now that's your technique that you have developed. Or someone must have developed it already 100 years ago, but they didn't share it. You know what I mean, right?
I know.
So the same thing I do is, if you have a mannequin at home, and because with the ADC we do, a lot of people sell it. I didn't sell it because I felt like it's important. So if I have a big diastema case and missing or small teeth, I would say, not missing on Monday, why not I replicate the same scenario on Sunday night? So when I'm there on Monday, I'm already comfortable that I've done it twice last night. So then I'm doing in the patient and I'm like really comfortable. Same way, I did my first 8 veneers cases after doing 3 times on the mannequin the last night, and then the first case I did, and my principal dentist came and he has assessed it for me. And he said I couldn't find a single mistake. Same thing I did when I did a prosto course, I think with the prostodontist, I can't remember his name. And he was going to everyone's desk, and then he came to my bench and he kept looking at my crown prep for 2 minutes, and he's like, no feedback because I can't find any. But it's something that you practice on a mannequin so many times. Like even if you see clinicians these days, like top clinicians, they're sitting down on their weekend, they're working on the tooth, drawing a diagram. Like when we do composites, you first sketch it a couple of times, then you wax it, then you do it in the mouth. You get so predictable results. But if you only do it in the mouth, you may get, may not get it. So the same way I was doing as well. So implant and ortho is happening. For veneers, I have Nexum Belograde, I have Dr. Stephen Cuthbert, I have so many amazing YouTube videos there. And I was prepping teeth like crazy at home. So there's a movie happening and there's a music happening on Sunday, and I'm like just prepping teeth like crazy. And then I used to take photos of all 5 different preps I did. And again, on the Sunday, it's all on the wall. I've taped it on the wall, and now I'm looking at it just like this. And I was like, now if I do this prep on this patient or in that client, is it going to work or not? And you don't have to ask anyone. You will be able to tell yourself it's not going to work. You have to do a crown with that patient.
Yeah. So I follow you. You're saying, so are you saying that if I ever rock up at your place, there's going to be a little workshop space where there's a lead mannequin with drills and all that?
Yes.
Yeah.
Yes. And I feel like it's, why not? You know, I can still say some of my students, they tell me that, this crown prep, and I was like, I can guarantee you that the one I will do tomorrow, it's going to be better than what I did yesterday. Yeah. So the more I do it, and that's how clinical work is, right? Gordon Ramsay, he has this video in which, and again, going off topic, but he's carving a chicken blindfolded. And he was so comfortable doing it. First is the chicken, it's outside the mouth, right? It's not in the patient's mouth. But he was so comfortable doing it because he's doing it 40 years. And he said, I've done it 1 billion times and now I can. But with a sharp knife, you're not comfortable with a blindfold to cut anything, but he was able to do it, right?
Yes.
So the same way, if you want to perfect your skills doing a veneer, why not do it 1,000 times on the mannequin first? And even if you feel you're great, do it 1,000 more times and you'll notice you're even better than that now.
Yeah.
And that's how I think clinical skills are like that. The more you do, and I've learned this initially, I felt like I was doing an endo case. It was a very difficult curved canal case. I'm talking about 2013. And I was finishing my 6 months rotation in the hospital. And my professor was like, how's your endo going? And I was like, I feel like I can do any case now. And he looked at me and he was like, okay, that's amazing, Matt, because I've been working for the past 31 years and still I cannot do every case. So if you can do everything in 6 months, that's good on you. And that hit me. And I was like, that's so true. So initially we feel like we know a lot. And with time, you start realizing that you don't know anything and you need to learn a lot to get there. And then with time, you understand that, still, even if you have 40 years or 50 years experience, there still will be 10 to 15% cases that's going to go over your head. So that's okay. You can refer those cases.
Yeah.
It's hard to do everything. And I think the best thing what I learned about the ortho course or an implant course was, or any course that I've done now, after you get more knowledge, it's the power to say no. I cannot do this case. I know someone who will. Because initially the problem is we want to do everything.
100%.
And my problem was as well, and the most difficult thing for me with my CPD journey was to stay calm and say, take your time. And now I say this, people say, wait, where do you want to see yourself in the next 5 years? I was like, no, not 5 years, 20 years plan now. 5 years is too quick. So I think initially, because again, I had to wait a lot as well. Wait 5 years and every day I used to work at the dental assistant. I was like, I'm a dentist. I wish I could take the handpiece and I could do a crown trick, right? But I couldn't. And that, I think that 5 years waiting and trying and, trying again that I don't know if I'm going to pass or not, that ignited my passion so much that now I just feel like I've got that gift and I want to do the best way possible. And if I can't, then I'll be able to justify myself. So that's what I like to do now is I want to make sure that, calm, take your time. Any case you feel that initially is difficult, you should know when to say no and say, this is not for me. Like this 60%, 56% class 1 cases, class 1 malocclusion, class 1 this, class 1 that. Why don't you stick with that initially? Why that one student who just started ortho want to start treating class 3 the first day? Why there's so much headache? And I know clinicians who say that this patient's paying me $40,000, but let's not touch this case. Because that $40,000, you feel it's really exciting, but it's going to come bite you in the ass. So many times they're going to quit industry, all and all that. So I feel like it's important to stay calm, take it as a journey, say that, one step at a time, map out everything, plan everything. What do you like? And because I graduated and I worked before and then I worked as a DA, so my journey has started after 2012. So I'm already seeing, assisting one person working as a practice manager. There were like 3 different clinics. So I'm in touch with 50 clinicians. So every clinician you see, so you're trying to explore which area do you want to work at. But if a fresh graduate comes in, I feel like the first 2 years, they should explore. They should explore. Because like myself being a maxillofacial surgeon that I want to become, and now I'm into cosmetics. You don't know, things change. So maybe you're really interested into surgical work, and tomorrow you end up being an endodontist. Because we never explored that place, right? That's the thing. So the first 2 years, learn a bit of everything so you become more on the I won't say holistic side, but I would say you treat a patient as a whole and understanding and planning everything, and then slowly try to explore yourself, and where you feel you're so passionate that you don't mind spending 3 hours on your Sunday prepping teeth for your Monday case. That's the area that you are passionate about, and you will never feel tired and regretful your entire life, because now you've found something that makes you so happy and excited. So as soon as you find that in 2-3 years or 5 years, sometimes people take 10 years to find that. It really varies from person to person and clinician to clinician. Maybe they never met a clinician who ignited their passion. You know what I mean? But as soon as you find that one thing and you say that, okay, this is that one thing, it makes me happy. I don't mind spending 4 hours on my Sunday, or I don't mind doing 4 reviews on patients because I want to get that line angle pinpoint perfect. Otherwise, the patient's going to not say anything, but you sleep at night and you see that line angle. And it happens with me all the time. That I sleep, I close my eyes and like that line angle is not good. I have to call that patient tomorrow because the pictures are there, but then, you just keep seeing it. Yeah. And I always tell everyone I would have never noticed the line angle if I not take those 50 photos in that case. Because every angle, you will notice that every angle, even like 3-degree angulation change, shows you a different line angle on the tooth if you work with a ceramist. So we take a straight photo, we take a side photo, that's it. If you take angle photos all around, you start noticing the characteristics of the tooth so much differently on a natural tooth, so much differently. And you start to say that, oh, wow, I never noticed this before. So I feel majority of the time, and especially for young dentists, if you want to become good dentist that you're really proud of yourself in the next 5-10 years, stop compromising with little things. Because the problem is we compromise with the little thing, we finish our filling and we realize that there's a loose contact. But we say doesn't look too bad. Wouldn't that be better to just drill it and just with everything open? It's going to take you another 5 minutes to seal the contact now. But if we compromise on that little thing, the patient comes back after 3 weeks, they say, now the food's getting stuck there. Now what happens after 3 weeks, you say, okay, I'll have to redo that. Now they come back after another 2 weeks when you have an appointment and you were running late that day. Your 50 minutes appointment turned into 30 minutes appointment. Now the patient has come the second time. That means your stress level is high, that you have to get it perfect. Because if you don't get it perfect, The third time, they're not going to come to your door. They're going to go to the dentist next door saying that you did a shit work. So I feel like if you don't compromise on those little things, that little things become big, and then that 1 crown becomes 20 crowns. And then you notice your cases start to become a bit more flushed. I really like what Lincoln Harris says, and I've actually mentioned in 2 of my videos as well. Don't rely on luck and pray. That's so important to understand that, half of the time we're like, okay, it might happen. And then I'm going to pray a bit. The patient's not going to come back. They might not come back to you. That's the problem.
Yeah.
But even if they don't come back to me, the problem is I'll be like, that one case I missed, I feel like that small changes that I would have corrected would have changed and shaped my journey to be able to not compromise with my quality of work. And the one thing that I've seen is, and one clinician taught me this again back in 2015, and he said, the patients won't say anything, but when you genuinely want to do a good treatment and want to help them and provide the right care for them, they can sense it. And when they sense this, they will never leave you. Like for me, if I need to get a root canal tomorrow, I'll be very honest. If there's a final year student in any university and he's really passionate about it, I would rather get it done from him. Because I know he's going to assess 4 angles and say that my obturation is not good and, my angle is not good. But that another clinician might do it in 10 minutes. Again, his experience and everything. But I'm just saying that patients don't care if you're 40 years experience or 2 years experience. My patient knew that I'm going to place the first implant on him, but he said that I want this dentist. I don't care. I don't trust anyone else. Because it starts from a filling and a clean, that the care you take, that I'm going to put a bit of a numbing gel and I want to make sure we wait 5 minutes so you get a painless anesthetic and then put the needle in, and they didn't feel anything, and they said that the other clinician was taking time and they were doing a 30 minutes clean. He took 50 minutes. I walked in the room. They didn't say, okay, but you're going to clean today, recline that chair. First 5 minutes, you sit down with the patient, you just talk to them. I don't care what, but it's not. The first 5 minutes, they can't be about dentistry. I talk to them about their cats, about their dogs, about what they're going to do, what they're going to eat, what they're going to wear. Are they planning to go somewhere? If they're not planning to go somewhere, why not? They should go somewhere. Explore something. And after that first minutes, you break the chain of their stress barrier. Then when you recline the chair, they already trust you. And once they trust you, then they'll be like, okay, I don't care if Dr. Laurence hasn't done this treatment before, but if he's capable of doing it, I trust him. I don't want anybody else to touch me. And this happens a lot these days. You notice as a 40 years clinician, we are referring to, and they'll be like, can't you do it? And you are like looking at yourself like, I don't know if I can, but they'll be like, if you can do it, I would trust you. And that's what changes. Those small corrections that we do in line angles, and if the color match is not good, you tell the patient that, this is the photo, because I kept looking at it all Sunday. I'm not happy with it. I know you are, but I don't want to compromise with our work, so I'm going to redo this. Yeah. And you redo it. And I feel like you start being more happy because you feel like you've done justice to what you've done. And then those small things, as I said, that 1 tooth becomes 2, becomes 6, becomes a full mouth. And then when you do a full mouth rehab, because you've worked on that principle, that one mistake you do doesn't bother much on 1 tooth. But if you're doing a full mouth rehab and if you've done one mistake on every single teeth, then that's the time you say that my top 10 veneers are not seating in, or the bite's not right. And that's where the disaster happens, because, we start compromising on the little things and now the whole picture is wrong.
Yeah. No, I hear what you're saying. I'm going to pivot a little bit here, yeah? So as a clinician, we always reach a point where they start to contemplate practice ownership, being a specialist or being a super dental GP, or even starting to think about starting a family. Can you share your thoughts on that?
See, I'll be honest. If I didn't work as a practice manager before, I was so keen on opening practices that, make sure, just settle down and get on practice. Because I worked as a dental practice, I was managing one, then I was at one point I was managing 2 or even 3, and then I went back with 1 because I told them I need time for my ADC as well.
Yeah.
I realized that the amount of stress you have to bear just for that 15%, and I looked at myself that for that extra 15-20% profit, is it worth it or not? So you have to ask yourself, is it worth it? For me, I felt like, no, it's not worth it. I can work somewhere on a very good commission and do good quality cases and still be able to earn really good.
Yeah.
Now, the problem is people say, no, I feel like that 20% is a lot for me. So you earn more and you pay more taxes as well. So at the end of the year, when it comes back to you, you'll be like, okay, I'm actually earning this much. You're earning a slight bit more.
Yes.
But I did travel 3 times a year. I spend time with my family. I still try with my friends. Tomorrow, if I want to leave and I want to join a new practice, I can. If I want to go to overseas for a 6 month trip because I'm on commission, or just for 2 weeks, it's my choice. And I think the way the brain psychology works, if you feel like you're not, tied up to something, you actually start enjoying work more. Anytime you feel like you're tied up, that, you're pressured, maybe you work wholly and you don't take a day off, but you're not pressured on it. That's what makes a lot of difference. So I know clinicians, they love, they have their own practices. They love it. And I have an option to do that past 3 years. But I was like, I feel like maybe I teach as well. So it's different for me rather than someone, because technically, because I'm teaching, I have an academy. So, I have my small business that I run as well. And then I do dental. So for me, I have that balance going on.
Yeah.
But for me to own something, it might be too much. But then some people, they say, ownership practice, especially with COVID times or before as well, sometimes your dental assistant's sick, sometimes your dentist leaves, sometimes your managers you have to replace. So I feel like with time, you notice that if you don't have a really good practice manager, even with them, and if you really like your dentistry, half of the time you can't focus on a dentistry or a clinical work because there's so much other factors and stresses coming that, now this is happening, the financial expense, and then this and that. So I personally looked at myself and I talked to myself that, is it worth it for that? Because I've managed practices, that extra 15-20%, is it worth it or not? And I said, no, it's not worth it. It's not worth it for my health. I want to travel the world. I want to explore more. Last 8-9 years already have been like a big journey. So now, while I can, I want to. But maybe in the next 5 years, I might be thinking differently. And I've been like, okay, I'm doing it everything. Let's just buy a practice. So I think with time as well, it changes. But as I said, initially, as soon as you graduate, like I have students who keep passing the ADC, and they call me, and there's this first thing they want to do is they want to learn implants, veneers, and they want to open a practice the next day. That's the first question I get. How difficult it is to open a practice. And I'm like, let's talk in the next 12 months. So the point I was saying, that it's very important to calm down and take your time and take it as a journey.
Yeah,
that's very important, because what you're thinking now, in the next 2-3 years, you might be thinking differently, and that everyone's different. That's my way of thinking. It's not like I'm 100% right or anything.
So, on that point, just as how would you say, as a practice manager, when you saw at the time, how did you go about, building a team of staff or associates, and what qualities do you look for, when you're hiring new employees or whatnot?
See, I felt like you need 3 qualities in the clinic. One is you need someone who has a lot of passion for what they do. Because if you have a positive environment or really influential environment around you, that one person motivates 10 other people around you as well. So if I say I have 3 practices and I want to hire 5 or 6 clinicians, 2 each, as a dentist, and I need support staff or other clinicians in terms of oral health therapists or hygienists, maybe 1 each per clinic, so 3 per clinic, and then I need a practice manager, then I need an assistant. When you hire people, you want to ask them, where do you want to see yourself in the next 5 years? But then how can you help our practice as well? So I need one person who are really passionate about their journey and their skills, one in each clinic. I need one fresh graduate in each clinic. So then they get influence from that person and mentor and train, so their journey skyrockets as well. And I need one person who just wants to do dentistry because we want to run a business as well, But because that one person is there, they're going to influence the whole other team. Then you get OHCs and stuff. Same way with the dental assistants as well. Why do the dental assistants get more sick so often? Because they hate their work. Nobody actually sit down with them and talk to them that, why do you hate your work so much? What can we do differently that you stop hating it that much? And they will tell you that, I keep working with one staff and I hate blood and they keep letting me assist extractions all the time. And then you be like, okay, let's give you something else. Some dental assistants, they really like social media. They're good at it, but nobody allows them to do it. So why don't you do the social media aspect as well? And sooner, if you work really well, because, we all need that recognition, but we all need some at one point saying that if you work hard, this is the reward you're going to get. So your brain starts to get stimulated that if I do this, I'm going to get this. Like if I'm doing all the perio and implant and this, and because my reward is I want to become a cosmetic dentist. My reward is already there. So their reward for every clinician or even a dental assistant or reception should be there that, if you first, is this something you want to do or you hate it? If you hate it, then you rather not work at all, because that negative energy of that one person is going to influence all the 10 people who are so positive. Now they start hating their work as well. But I feel like when you sit down and talk to them, they will tell you that, this is something I don't like. And you start to manage it around in a way where they feel like this is something I will do. And this is something I get benefit from. And if you actually work so well on my social media, or if you start assisting me for my cosmetic cases, would you be also willing to take photos while I'm doing my procedures? And if you actually do it well, then this is your reward waiting in 6 months. If I'm talking to my patients and you can, while explaining it to them, write my notes, but also explain the post-operative instruction to the patients as well after I've trained you well, this is your reward waiting. And I think the thing that dental assistants really enjoy, they never shy of doing extra work. Everyone likes working when they feel motivated, when they actually enjoy the process. I think the most difficult procedure, even in dentistry or in life, is the one you hate doing. And the reason why we hate doing something, because nobody cleared our concept that basically there's a better way of doing it. Like everyone hates doing dentures, and then you realize there's a better way of doing it. You'd be like, actually, it's not as bad as it was. Everyone hates TMJ and bite issues. And as soon as you start understanding that this is just a basic way of understanding the bite and checking it first, you start saying that actually, it's not as difficult. Like implants are not difficult. I feel like if someone knows how the basic surgical protocols are, because putting a screw is not, anybody can put a screw. The thing is where people mostly vary and they struggle is how to do the surgical procedures, opening the flaps, suturing it up. Do we do it direct, or should we just do an immediate, or if you want to do an immediate, how we do the soft tissue contouring? But ideally, that's basic. We should have learned flap designing and all those things a lot first rather than doing the implant first. And then now you want to do an implant, but you don't know how to do a surgical extraction. So maybe our basics were not dealt in the first place.
Yeah.
And that's why we were like, if someone has done the basics correctly and then slowly make the way up, you will notice that, when you start placing implants, if someone has a good surgical hand skills, they feel like he's a better implant clinician because they already have the basic surgical skills.
Dr. Mak, I want to come back to the clinical side of things just for a second, yeah, where you were a practice manager. Obviously, prior to that, you're a clinician, right? Before you had done some dental assisting as well, right? So were there some sort of things that you had some training in or before, because like you said, if you hadn't had any experience before and you just kind of take on the practice managing, there would be huge challenges you would have faced, How did you kind of overcome this? As people who would be contemplating opening up your practice, they have no experience or very little experience in it, right?
Absolutely. It's a very good question, actually. I personally feel the reason I can sense it that my dental assistant is stressed or she is not up to par today because I have worked as a dental assistant. And I exactly know that, when you're shaky and your body language is not good, that means you're not feeling good about something and it's completely ignored. If I would have never worked as a dental assistant, I would have never felt it. Like someone to say that, oh, my dental assistant is like that, just work as a dental assistant for 6 months, you will find out how difficult it is, how mentally challenging it is. You've seen people that, dental assistants are crying when their main dentist who they work with for so long leaves because now they're like, a new dentist going to come in and my life's going to be shit because if I don't get a connection with them. Same way, if I didn't work as a manager before, I would have not been a good clinician because now I don't know how to run the place. I don't know how to manage my staff. I don't know how to train my receptionist or my manager because how can I train them if I don't know it myself? It's the same way that if I start teaching implants, but I've never done an implant. So when I worked with Dr. Marella, as I said, she was really experienced. It was very difficult, but she was an amazing clinician. So she started from dental assistant. And initially when I say dental assistant, that means I'm just taking the pins out and cleaning the instruments. That's what I did for 6 months. And I used to just stand at the door and observe. So making my way up. So just cleaning instruments, maybe just doing the bins, just mopping the area, the floors and stuff. And sometimes, the window cleaning and stuff. But I was still really excited that I'm working in Australian clinic that I wanted to do. So my motivation was on a whole new level than someone who's maybe not. So I did that. And then she was like, okay, now we're going to step you up. You're going to start doing assistant to maybe hygiene and basic clinics. So we did this. And then she said that, her clinical coordinator at that time left after me working for 14 months. So she was like, okay, now you're going to start doing this as well. A bit of advantage for me was because I'm a clinician, I can see things differently. So a lot of assistants, because they don't know the final result, they're looking for things. And the dentist, because when Dr. Marla is doing something and I know she would need the matrix band next, I already have the matrix band prepared. But at the point where I know that she has teared the gums, now she can't put a matrix band, so she has to need the cord first, because I can see that I already have the cord ready. And that's what, start slowly. So then I worked as a dental assistant to a clinical coordinator to the patient supervisor. And then I became I was not official practice manager as a title, but then I was managing our whole practice. Last 6 months, I did that. And when I had an interview with the Sunshine Coast up north, actually, a practice, that's what I told them. I have worked pretty much everything. I was not like as a designated practice manager, you would say, but I've been trained with everything. So if you actually give me the opportunity, I'm up for a challenge, I would say. And if someone shows me, I'll be fine. I know I trust myself. I know I work pretty much. I worked in tough environments, so this would be easy for me. So that's how I feel like now when I see myself, and that's why I'm so grateful that I get a chance to make my way up. So tomorrow, if a dental chair is not working, I know how to open it up and, where is it going to be stopping and how to fix it. And I can train my dental assistants because I have worked. I exactly know what difficulties they face when they're not comfortable with the dentist, when they're not feeling as motivated. What can I do to do it differently? When you have a receptionist and she's struggling with it, how can you help them? Because until you have not done it, so for someone, I feel like if they want to open a practice, it's a good idea to, get involved with these. Even if you're working at a practice, spend time with your practice manager. Step up and spend time with your dental assistants. Spend time with your receptionist, Just tell them, share with me your day, how things are going, how do you set up things, how to do your payments. I think it's so important that, the day my receptionist is sick, I know how to do everything. So I'll be like, I'm mentally not stressed. So I'm like, okay, I will do this. You can do that. You can clean the room. I can do the payments. I can come back. So I feel like it really helps when you've done everything. And that's what sometimes is missing. And as I said, it's really easy for me to blame the technician and say, because of you, the porcelain veneers were not good. But I would never look at myself saying that my mock-up was your shit. I didn't guide him, right? So the same thing is, if you don't guide your team, and then you feel like your final results not coming and your progress is not happening because you did not guide them correctly. If you guide them correctly, any human being out there, even we talk about pets and stuff, you take care of them and you love them and, you share the respect, that they will give 100 times back to you. So that's just basic, the human concepts we say. But coming back to your point, I feel like initially, yes, a lot of people want to open the practice, do an implants the next day. The problem is, you have done 5 years of dentistry, dental school, and you're excited to work, and that's why I say that, this is the time when a good mentor can make a lot of difference. Someone who can also see your potential, because if I work with someone and they never see my potential, I'm getting wasted because they will never understand what I feel. But if I work with someone, they'll tell me that, Lawrence, I exactly know what your potential is. These are the things you're doing which are excellent. These are the 5 things that you want to improve. And this is your 2 weaknesses. If you work on this, you can be a better clinician in the next 10 years. And then you are guiding them through their journey. And then you are trained in a way that you are comfortable in 5 years that I can open 5 practices if I want to, because now I've learned it. So it's better to learn and then do rather than doing. And then, like, there's a different learning path. They say that, like, you can open a practice and you learn it anyway, but you're doing the hard way. Why not have a predictable approach that I know that this is predictably well to do bridge in this case, not an implant? It's better to do that way rather than saying, okay, let's place an implant. If it fails, we know in 6 months. Same way you're saying that, I'm going to open a dental practice. I have no idea about it. I didn't know how to train a staff. I've never worked with a dental assistant before. I have no idea about clinical management. I have no idea about financing. I have no idea about how infection control things are protocoled and, structured. But I would still like to open a practice. So they'd be like, are you going to spend all that money on, this and that? But then certain time what happens is one thing that there's 4 or 5 clinicians, they combine together. And maybe they're 4 friends and they say, why you're doing it alone? Let's make a team. Because I know some clinicians who did, that's what they did. They were like young dentists and they just graduated and there was 1 year and the 4 dentists combined their skills together. And they said that if Mac, you're alone, you might be stressed. So how about we divide it? You focus on the management. I will focus on the finances. She's going to focus on doing the staff management. And the third person is going to make sure we focus on our future goals and we'll combine the skills. So we have some difficulty, we all manage together, and they're running 3 successful practices right now. So sometimes, yes, they were young, but then they divided it rather than one people stressing everything and,
So like the
Yeah.
Avengers
Yeah.
assembled.
yeah, yeah.
So, I mean, you've mentioned struggles, right? But have there been any dark moments in your, CPD or dental journey so far that some of our viewers might not have known about?
I think with the ADC, I think my darkest journeys, I'll be very honest, and that's why I teach ADC, because I'm passionate about it, because I relate it to myself. It's very difficult when 30 people sit and 2 are passing, and you feel like, what happened to the other 28? They're also clinicians, they're really good, right? So when you can't, that's what I'm saying, right? When I see the final report and I know, then someone's working hard for it. But just imagine you're saying that I'm working and busting myself, but it might not never happen. Because I know clinicians, they've been doing for 11, 12 years, they still haven't passed. There are clinicians, but there's some who passed in 2, 3 years. So I think for me, I think the darkest moment was when I was doing the ADC and master's was done. While doing master's, working, and then ADC, and then the master's was done, and I was just literally sitting and saying that, okay, it's not happening. Okay, the first attempt is gone, the second's gone. Is it happening? Is it not happening? Should I keep pursuing? Should I quit dentistry and just focus on being a practice manager and just buy 2 practices? I can just run practice. You know what I mean? That contemplating is just, and it comes to a point where it's really stressful and you start being negative as well, that all the negative thoughts, that, how to be motivated at that point. It's very challenging and very difficult, because
You see your colleagues, right? You see your colleagues and their life is moving forward, and you kind of feel like you're stuck. You're not moving.
Yes. And I think what's most difficult is when you have the talent, you can do it, but you just cannot
Show
That's
something
worse.
for it. Yeah.
That's worse. Like a dental assistant, she maybe is upset or she's not working on other skills. But if she exactly knew how to place an implant and then she cannot, her stress level is going to be skyrocketed at elements that, I cannot do it. So certain times I was like, I'm not going to work in a dental clinic because it's going to give me high anxiety again and again, because I go there and I see all the procedures and I love that, but I cannot do it. And then that actually frustrates you and raises that level where you start being depressed that, should I just stop working in a dental clinic so I don't at least see it, It's not like if someone's dropping in my face, you know what I mean? So those were the times that difficult, but I always believe that, if you put in the work and you keep working on it, it's not today, tomorrow, but it does happen. And that's what I tell everyone that, anything you want to do, even from max facts to endodontist, any exam you want to pass, just work on your mapping, which is your planning, that this is where I want to see myself, this is what I want to do, this is where I want to achieve or where I want to reach the final goal. And, this is what it's going to take. And then you put your head down and keep doing the hard work. Yes, some people get it sooner, some people don't get it sooner, but one thing is for sure, someone who did not give up, they all have achieved it though. That kept looking at it. And I think my motivation was again and again looking at, there's a JBS Vasquez, one of the dentists, he does a lot of NTI, TSS things that, jaw problems. He does all those things. And then, looking at Rubenstein and, all those things. And I was like, okay, let's keep going. Let's keep going. And you look at people's failures that, an Olympian, he worked 15 years to get to the gold medal. He tried 15 years. And I was like, I've only spent 5. let's give 10 more to the point. But that's again comes to the point that when you find something that genuinely makes you happy, then you are fighting for it. But if I know that I hate dentistry or don't like it, then there's no point of spending time. I know people who like management so much that they do dentistry, but they open clinics because they love it. It's their passion to just open a practice, run a business, all those aspects which I might find stressful, other people might find stressful, but for them, it's their leisure time. So again, for them, maybe if there's the passion and there's the goal to have multiple practices and they really enjoy running practices, maybe for them, it's just best to quit dentistry and just keep on opening practices whenever they feel like they can just do a couple of patients when they're free.
Yeah. Oh, wait, the dentist called in sick. Okay, I'll just rock up. Let me do it. No, that's fair enough. Look, Dr. Mak, there's so many more questions I want to ask you, but, I'll leave it for the time being because that's all the time we have for. So I want to thank you again for coming on the show today, but if you could let the people know how they can find you.
My pleasure. No, thanks for having me. See, my social media handle is Dr Murtaza Mak. It's same for my Instagram to my YouTube. So if they search with my social media handle, Dr Murtaza Mak, they should be able to easily find me.
If you like this episode, drop a comment below on your favorite part or leave a review. Don't forget to share it with your friends, and we'll see you in the next episode of CPD Junkie podcast.